Okay, so the next thing we're going to talk about is esophageal banding. This is specifically for esophagus, and you can do it in the stomach also, but it's not near as effective. But for esophageal varices, basically varicose veins in the esophagus, those are very dangerous. If they open up, people can bleed out. Really, that's why they're considered an emergency situation oftentimes. So anyway, this is going to be in the bleed cart right over there. This is called the Speed Band Superview Super 7. Basically, I call it a 7-shooter. A lot of docs call it 7 shooters also, I think, but it has 7 bands. Okay, we only have one. We don't have any other thing and stuff. So basically, I'm just going to open it up. Remember, with GI things, it's a clean procedure, but it is not sterile, so you don't have to worry about touching things, but you never touch the scope with your hand, and you don't touch anything else with your bare hands. You always use the gloves. So anyway, this little thing here, just toss it. You don't need it. Okay? So, for these purposes, I'm going to pop this cap off, and I'll explain why I'm going to do it this time, and then maybe not with other times. But you have your crank, and then there's a wire that comes in here, and just like with other GI things, it's going to be kind of springy and flipping all over the place or whatever. So sit this right here, get it kind of out of your way. Now you're going to want to hold on to this. So then you come up to your scope. I recommend turn the lights on. It's going to be dark in the room before, but turn the lights on so you can see what you're doing. But turn off the lamp. This machine is off right now, but just turn the lamp off so that you're not blinding yourself, and you'll know what I'm talking about when you do blind yourself. Okay. There you go. Perfect. Yeah. Let's go ahead and turn it on. So anyway, my light source is on. And it's not going to be a big deal yet, you know. So anyway, just kind of set that right there. Because these caps are so flexible, they're very rubbery or something, but they're very springy. So for teaching purposes, I'm going to take the cap off, and I'll explain why. So take your biopsy button off, and then put this over here off to the side. Then you're going to make your way down to the end of the wire. It's pretty long, but it's got a loop.
There we
A
go.
little wire loop. And then it's going to go into the biopsy port. Notice the biopsy button is off. Put that in there, and then just start feeding it through. And in just a second, you're going to see it come out the end where that light source is, and you're trying to look, and this is where you're going to want to just shut the light off, because you're trying to see and it's going to blind you. So just reach down here to shut the light off. It's a long press, not just a touch, it's a long press. Okay, to turn it on, it's one click. It's a long, you have to long press it off. Okay, so now you can actually see what you're doing. I showed you that because a lot of people don't do that, then they can't see what they're doing because they leave the light on and all that. So you're going to pull gently, very gently, pull this through. And as you pull this, it's going to cinch this up to the biopsy port. See how it goes like that? All right, so just leave that there. Now the next thing you're going to do is push down on this with a good little snug. Don't push too hard, you're going to break it, but just kind of snug it down in there real nice, okay? And then this is a Velcro strap. You're going to undo the strap, bring it back around the neck of the scope. Then you have a loop here. You're going to loop that in, and then grab the Velcro strap, and then tighten it down. And you want it pretty tight. You want it as tight as possible. Got a little bit of give, but you don't want a whole lot of give into it at all. You can even tighten it up even more if you want to. So anyway, that's how you want it. So then you're going to get your little piece, your other piece here, that's inside of your blue container. Open it up. And there's a little irritating thread. It's literally cloth and it's all jammed up and everything like that. Some people like to wait until the very end to peel this wrapper off. To me, it gets in my way, so I like to peel it off right away. And it's still kind of hard to peel off.
That does look like a pain in the butt.
Yeah, it really is. It's even harder when it's on the scope, so that's why I like to.
Keep wanting to reach down for my pocket now to cut it off.
Yeah, that would be handy. Okay, so normally it doesn't take that long, but for video purposes it had to be a pain. Alright, so you peel that off. So now it's all open and exposed. Then you turn it over very gently. This all needs to be kind of a gentle thing here. So, and then while you're trying to see and while the doctor is watching you and everybody's waiting on you, you're going to have to put your fingers through this loop. It's just a very thin thread. And then I always like to open it and get it spread open and stuff. And then what you're going to do, go like that. And then it's going to go thread through the wire loop. So this cloth thread is going to go through the wire loop. And you'll realize how old your eyes really are when you're trying to thread that. And then you make your loop, and then you're going to take this end and put it back through the loop.
Okay.
And then it just kind of cinches up. Okay. So then just set it down on your table. Get all this garbage out of the way. And then you go back to your gear, and then you start cranking.
Oh, here, let's see.
Crank.
Let me come over here and get those.
Okay.
And this. All right, there we go. Go ahead and
Ignore these other rubber bands and stuff like that. Click. Notice how with each click, that banding thing that we just threaded through goes into the scope. And you can go faster. As a matter of fact, you're gonna go faster, but don't go super fast, because if you go too fast, you're gonna release your rubber bands, and you don't want to do that. So with just like a little bit left over to play with, then you're gonna set the neck of the scope down. And then you're going to take your rubber bands. You see that here's all your blue rubber bands, and then the end here. You're going to thread that on into your scope. And then it's going to just slide on pretty nicely, actually. But then once it stops sliding, basically that's where you're at. Okay, you don't want to keep forcing it and things like that. Then you set it down. And then you take your crank and then gently turn it. Sometimes, okay, that's good. Sometimes you can't get that extra one full turn and crank it in. Sometimes you go halfway and it gets really tight, so you just stop. Okay. But so anyway, now you're good to go. You give this to the doctor and then they do it. So when it comes to doing an esophageal varice, basically what they're doing, we'll pretend like this is the varicose vein, the esophageal varice. This is the problem. This is the bleeder. People do die from these, literally. What they're going to do is, after you hand them the scope, you turn your light source back on, obviously. Then they'll put it back down the patient's esophagus. And then they'll cinch up to the esophageal varice that they need to band. The reason why you band, you just try to make it shorter so it's not as bloody and voluminous. So anyway, you put it right there, and then when they do the suction, it's going to suction this tissue up into the scope. Notice how it's going up into there, right there. It's going to suction, suction, suction. Let's see if I can actually deploy one of these. So they're doing the suction. It's going to go, it's going to suck in. It actually makes that noise. And then they're going to do the crank, and we'll see if we get lucky and we can deploy one of these. 1, 2, 3. Okay, look at that. So that crank, that actually deployed the rubber band. The rubber band went over the top of the esophageal varice. What that does, that'll stay on anywhere from 3 days to 3 weeks or even longer possibly, but that occludes, it chokes off that part of the varice, cinches it up, makes it small, and this is going to die off. Underneath the scab, or underneath this rubber band is going to produce a scab. Once this dies off, it falls off, the rubber band falls off, you poop it out and you're good to go. But anyway, that just makes this big, bulbous varice that's bloody and dangerous, makes it nice and small and things like that. Frequently you have to be banded several different times if it's to the point you need to be banded. But anyway, so that's the band. And then at the go ahead.
Well, I was just gonna, and you might have been getting to this, but so now we're done as the tech, especially. Now you got a scope with all this connected. How do you?
Okay.
What's the next steps?
Absolutely, great. Let me just show you one more thing about this and stuff. The neat thing about a 7-shooter is that all these blue rubber bands, that's one that's down here. Yeah, these are all rubber bands. They're just wrapped around there and stuff like that. And so for playing purposes, we're going to deploy one. You can watch it go. This is what we just did here. Mm-hmm. But here we can go on. Ding! Who knows where that went? That just shot off, you know. We can shoot them off into here. You can see how small they really are. See, here's a little one right there. Little bitty sucker. Yeah. But I should be aiming these at you. That could be fun. But anyway, you see this white one right here?
Yep.
That's actually the same type of rubber band, but it's just a warning shot for the doctor. So if they get to that point where they're going to see a white rubber band, they know they only have one more rubber band to go.
Oh, okay.
It's just like a warning shot for them.
Got it.
And this bang just firing off. You don't have to, but since I'm doing it, it's kind of fun. So that's why they call it a 7-shooter. Okay?
All right.
So they're done successfully. You've done the procedure, and by the way, this is always done. The banding is always done at the end of the procedures because you don't want to go past the rubber bands with the scope because you can knock the bands off. So anyway, they've done the procedure, they've deployed it, and they're all good. So now, what you can do is, I've seen people do it a couple of different ways, and it kind of really doesn't matter. But take your Velcro off. That's how I like to do it. Pull it off, and then pull this wire out. Okay, just like that. And then pop that off because I've used all of the rubber bands. Now, if some of the rubber bands were still on there, then you wouldn't be able to do that. You'd have to actually just break this cord, which is fine. It's just thread. You know, you just break it. So you can do it a couple of different ways. It's not going to damage the scope. It's not going to hurt anything. You know, it's kind of easier just to take this off, undo the Velcro, take this off, and then break it off. You know, and you can pull that off, and it's kind of satisfying to break it actually. You know, so anyway, that is banding. We do a lot of it. It literally saves people's lives. I've saved somebody's life in a very, very, very big dramatic way. A couple of different times with these. They're fantastic. The doctors, half and half, will know how to load this. The other half does not. So do your best. They should know how to do it. And if you're struggling, they should be able to help you out and to finish loading and stuff like that. But anyway, that's the bander.